Hi, this is Alan Wallace with Local Republic TV. Today we're going to talk about finding the best pain management doctor in the Dallas area, and for that matter, in the nation. How to do that. We have with us Dr. J.P. Benavides with Paragon Pain and Rehab. Thanks for joining us today, Dr. Benavides.
Alan, thanks for having me.
So when we talked prior to taping, we went into a great amount of detail about pain management and the fact that there's doctors that are a good match and not a good match. Tell our viewers how they should go about finding that pain management doctor that would be right for them.
I think one of the most important things, especially with today's technology, is going online and looking at that particular doctor's online reputation. It's going to give you a good idea of what other people that have interacted with them think about that particular doctor, and can also give you a good idea of what they can offer you.
So that sounds like a great place to start, finding somebody that others are speaking well about, looking for that great reputation, that 5-star reputation. Easily found online, obviously, but I imagine you can check around town and ask folks that have been there. Once I've narrowed it down and say I've got a few left and I'm looking for, well, who do I pick out of those that have that 5-star reputation, what else should I look for?
Well, obviously, you got to tailor it as best you can to your particular problem. Pain management is kind of a special area in medicine where there can be multiple specialists that can treat chronic pain and acute pain. Anywhere from psychologists, traditionally anesthesiologists, neurologists. All those are different areas that do regularly manage painful conditions. Particularly my office, me and my partner, Dr. Vargas, Norberto Vargas, we are both board certified in physical medicine and rehab, or PMNR. That's a field that has definitely a lot of musculoskeletal problems, which treats a lot of musculoskeletal problems that can often be sources or causes of chronic and acute pain. But it also has the advantage of being, we're very familiar with neuromuscular issues as well with respect to the nervous system, anywhere from simple peripheral compression syndromes, something like a straightforward carpal tunnel syndrome, or spinal cord injuries, degenerative nerve diseases, people who've suffered strokes, and as well as other, chronic painful conditions from multiple traumas, even cardiopulmonary issues like significant cardiovascular disease. All of that is usually covered by PM&R or physiatrists.
That's very interesting. I'd never realized that there was actually that many different specialties within pain management. So if I have a particular issue that I know, and let's just say for the sake of argument, I've hurt my back. So now I'm looking for a doctor that's got that PM&R and they've got the great reputation. Is there anything else that I should be looking for before I make that commitment to work with somebody long term to manage my pain and hopefully get me out of that pain?
I think something important to consider is definitely the culture of the particular practice. That can be particularly important in pain medication, in pain medicine. Not only can certain treatments in pain management be very helpful and help you improve your quality of life, but if you flip it around, they can actually be deleterious to your health, particularly with the biggest example is pain medication, with the comorbid issues of dependency and overdose. Just turn on the TV nowadays and you're going to see that that's a huge increasing problem. And that's a very serious issue. And if you end up at a practice that's just going to treat you like a number, or that's just a pill mill that you walk in there, sign a prescription, and walk out, there's no way you're getting enough attention that's going to be needed and that's required to keep you as safe as you can if you are on a potentially dangerous treatment.
That's actually a very great point. So we're looking for somebody that other people speak well of. We're looking for somebody that really has a specialty for what our particular need is, and then on top of that, we want to meet with somebody that's going to listen to us and not necessarily just treat us like they treated the last patient and like they're going to treat the next patient. So all that being said, and like I said, great advice. Let me kind of turn that around on you then, Dr. Benavides, and let me ask you, what are folks saying about you? I know you've been in practice for 8 years, and you've already mentioned some of the specialties. What kind of specialties do you bring to bear?
Well, as I mentioned before, both my partner, Dr. Norberto Vargas, and I were both board certified in physical medicine and rehab. Additionally, I have a board certification in sports medicine. And Dr. Vargas is board certified in addiction medicine. We're both certified in the treatment of Suboxone, and that actually comes in handy, especially with the types of treatments that we're regularly dealing with. And unfortunately, opioid dependence is a significant and related problem with that type of treatment. And personally, that's been one of the most satisfying areas of my practice, even though I came about it indirectly. The right person that comes to you that is looking for that type of help with respect to opioid dependency, it's like a night and day difference. And it's really exciting to see the changes for the better that we can do with a simple outpatient treatment like Suboxone. Another thing that our particular practice can offer is, again, we do a lot of interventional pain techniques, many of them aimed at the spine. You can have epidural injections for pain throughout the axial spine. Additionally, we do cassette injections and radiofrequency ablations for long-term relief of arthritic type pain in the spine. We even do spinal cord stimulators, which is a technique that we use for people often that have had surgery that didn't come out very well, and it's a technique that can give you some very significant relief with respect to chronic pain, and can even decrease the need for some of these medications. Another thing that we can offer in our office is peripheral injections, many of which we're using ultrasound-guided therapy. This is a technique that some of the more advanced and leading practices are using now in everyday clinic, where previously you'd actually have to go to a hospital and potentially get exposed to some ionizing radiation, which in excess can be definitely bad for you. We can do now very safely without any radiation exposure, doing these injections just as safe as before, much more conveniently, and we get some very good results with that as well.
So basically, I mean, obviously you have a great deal of expertise and experience. You offer a wide range of treatments for the different ailments that could be causing the pain. You had mentioned earlier and really put a great emphasis on making a connection with the doctor and finding out what the culture is like within the office, so that you're not treated as basically a cookie cutter patient, but very individualized. What kind of individualized care will our viewers get when they come to your office?
Well, I think from the very first time they pick up the phone to give us a call, if you're trying to set up a new appointment, we're trying to get you in as fast as we can. Obviously, I think that's important, especially in the types of patients we're dealing with. These people are in pain and suffering, and we want to try to get to the cause and try to address it, if not fix it, as soon as we can. Additionally, when you do finally come in and talk to us for that first time, we're going to spend time with you. If you're just going to be processed as fast as you can and not be paid attention to, not only are you not going to be able to identify the right problems, but another important quality of this is understanding the person who has the problem. You have to treat the patient themselves, not the pain, not the disease. And I think that the way we do that, we're going to we try to get the best outcomes that we can, and very often, a lot of our patients are very satisfied with the way we can help them.
That is absolutely great. So, for our viewers, if you're in the Dallas Metroplex area, even up by Paris, please give Dr. Benavides a call at Paragon Pain and Rehab. Their phone number is 972-203-3600, and get a chance to experience some of their cutting-edge technology and their world-class service and the time that they spend with you as an individual to find out exactly what your needs might be. Dr. Benavides, thank you so much for joining us today.
Thanks, Alan. I had a good time.
And to our viewers, thanks for watching. We'll see you next time. Bye-bye.